This segment of Delmarva Life is brought to you by TidalHealth.
Before the break, we discussed the medicinal powers of laughter, but that's only one aspect of maintaining a healthy lifestyle.
If only it were as easy just to laugh all your health concerns away. But the reality is that solutions to issues with our bodies and our lifestyle requires a much more comprehensive approach.
Which is especially true for something as complex as breast health. And here to give us an overview on that subject is Dr. David Seckler of TidalHealth General Surgery and co-director of the TidalHealth Breast Center in Salisbury. Doctor, thank you for being here this afternoon.
Yeah, thank you.
I want to start off by talking about the TidalHealth Breast Center. It offers comprehensive breast health care. What does that involve?
So comprehensive includes incorporating everything from the diagnostic part of breast cancer treatment with x-rays, ultrasound, to having a radiologist on board to read the films. And then if there's something abnormal identified on imaging, we can then refer the patient on to like a surgeon to consider whether the patient would need a biopsy. And then we have those capabilities available at the center as well. So. And even at the facility there, we actually have even a surgical center on the other half of the building there, so even the surgical procedures can all be done in one facility.
So with COVID, a lot of people put off their screenings. So explain why it's so important to get an annual mammogram and screening.
Yeah, sure. So, within a year, there can be subtle changes seen between a mammogram 1 year and then 1 year later on the regular annual mammogram. They could have a change that appeared that would trigger us to consider doing an investigation or a biopsy. And so as short as a year can make a difference in this. And so the earlier we catch things, the better the prognosis. The earlier we can treat things, the better we can offer more minimally invasive procedures to treat the cancers.
Now, the TidalHealth Breast Center is accredited by the National Accreditation Program for Breast Centers. How does a breast health center earn this accreditation?
Sure, so that's a program put out through the American College of Surgeons. It was a way to sort of recognize centers of excellence, if you will. Here in Salisbury, it was vitally important to us to make sure we're providing up-to-date, state-of-the-art care to our patients locally. And so that accreditation keeps us under strict guidelines, so we have to keep up to date on our education and our ability to work as a team and provide multidisciplinary care to the patient.
So you were the first general surgeon to perform stereotactic breast biopsies in the Salisbury area. What is a stereotactic breast biopsy? It's
basically, we can sanitize the skin of the breast, place a needle into the deep part of the breast where the spot that's abnormal in the mammogram shows up, and take a sample, a piece of tissue from that, all through just a small little needle opening. And because it's not something a patient can feel or we can feel, it's something shown on mammogram. And so we need a way to get to that spot, guide us to the exact location that's of concern, and that's what the stereotactic machine does. It's incredibly amazing technology that's really revolutionized how we do biopsies, and can all be done just with a small numbing medicine and a tiny needle to get the tissue, and as opposed to what we used to do, which was major surgery. And so, but because we're finding things early on mammogram, we need that technique, and we have excellent equipment here to do all that.
And we are fortunate that we have the TidalHealth Breast Center here on Delmarva. Dr. David Seckler, thank you so much
Thank
for joining
you for the time.
us.
Appreciate it.
Good information.